To welcome everybody to the annual meeting of the SBP Partnership, Southbridge Business Partnership. And actually tonight was our elections, and myself being the new president, Pete Canoyer being the past president, Randall Chinnick coming in as the new vice president, Karen Dyer is the secretary, and Lisa Brust is our treasurer. And at this point, actually, I'm going to ask whether, since we're waiting for Ed Moore to attend, ask whether anybody's got anything that they'd like to talk about at this point, so that we can fill a little bit of time till we get Ed in here. Pete, go ahead.
Yeah, I just have something to share with you from Peg Dean from Economic Development. Kind of dry, so let me do it now and won't have to do it later. She emailed me and said, I'll just read it. I'm assuming most of the local businesses are aware, but just in case if they're not, can you please remind SBP attendees that PPP funds are still available through the second round. And there's a website to go to. Anybody's interested, you can contact me and I'll share it, or contact her, and obviously she'll share that. But also there's a CDBG small business grant for businesses of 5 or fewer people. And she brought this to my attention a month ago. So I suspect that they haven't had a lot of takers. So if you know somebody who qualifies, all they would, the big qualification is that they were somehow impacted by the COVID virus pandemic. So if you can show some numbers whereby you were affected negatively, the small business grant is up to $10,000. So not a bad thing for a small company. I don't know if you fall into that category, but
I am happy to report that my business boomed in the pandemic. Everything went online. So
yeah. So anyway, she asked me to share that. So
well, Tia, just so you know, the way they calculate this is they're calculating the difference between 2019 and 2020, and it can be at any time over that period.
Right.
So, I mean, for a period of time, March, April, and May, you can show, whether there was a drop off in your business or not. And that's the way they're actually, showing the loss of the business, because a lot of people had basically a quarter of a real fall off. But for, a lot of us, our business took off after May.
Yeah.
But you can qualify if you even have that period of time where there's a drop off compared to the previous year. So,
okay.
I have to show it for 1 quarter.
Yeah.
Yeah. So, anyway, that's done.
Where the business is it just in like the Southbridge area or Central Mass? Or
No, I think that in both cases it's all of Massachusetts.
Okay.
I know for a fact that the small business one is, because I looked at the website and it just asked you if you were from Southbridge, Sturbridge, Charlton, Webster, Dudley, different areas. So it isn't restricted to just one town.
Okay.
But again, I think the important thing is that people aren't availing themselves of this. I know of one person who I've been trying to get to apply. She's a one-man band, hair studio, and her issue is the filling out the forms, and it's not that difficult.
Chris?
Yep, I wanted to let everyone know, in case they know of people, that probably 2 weeks ago now, the YMCA checked in with Harry Lemire because we were getting a ton of phone calls from people who qualified from the vaccine. At that point, they were over the age of 75, but had no internet access, no access to computer technology. So we are now working with the town and Harrington Hospital. And if you know anyone at all, and they do not have to be a Southbridge resident, but they do have to be within the Harrington 17 towns of residents. But if someone needs help, they qualify for vaccination, they can call the YMCA. We've got a group of staff that are volunteering, inclusive of myself, and we have been sitting at the computers and also have computers for people who want to do it themselves. And we are setting up appointments for the Southbridge Center down at, I'm going to call it the Armory, the Community Center, the Senior Center, whichever you grew up with most. To me, it's the Armory. But we have, in the past 2 weeks, scheduled close to 200 residents.
Wow, thank you for doing that.
Charlton, Oxford, Oxford's a town, but we haven't done Oxford yet. Webster, Dudley, Southbridge, Sturbridge, Charlton, we're seeing we've got the Brookfields in there. And it's not just for YMCA members. It's for anyone at all who needs help navigating the system, because we attempted to navigate the system ourselves with someone at first, and it's a miserable system. It may have changed. So we joined together with the town and with Harrington to help out whoever we can. So they can catch us there between 8 and 5 usually. We're taking the information and we're logging in the visits for people and getting them scheduled.
That's great to hear.
Yeah, I respond to Peter's comment.
Yep, go ahead,
about
Randy.
the woman who, can't find the time to fill out her application. Have reason to think that there are other businesses in town in that position?
I'd say there probably are people that, or they're afraid to fill it out, or now, for instance, Denise and I had recommended to the Metro Bistro that he apply, and he found out part of the reason he didn't get the first PPP is that some of his paperwork in 2017 hadn't been applied at the state level. And so there are different, in other words, people throw up their arms really quickly if they can't get through the process or they have difficulty with the process. And then there are a lot of flags that come up. I mean, here's some paperwork from 2017 that wasn't properly processed or something. And so he had to backdate, get all the paperwork put back in. But we're finding out that there's a lot of different things that will shut you down in the process. So,
yeah. Well, at our last board meeting, we spoke about the fact that we have a nice amount of money in the bank, and we've been thinking about how to apply that for the benefit of the town. I'm wondering if there's an opportunity here to hire somebody that could help in this process and make an outreach at least to our members and beyond.
we've got 80 something members at this point. So yeah, I mean, again, we continue to send out the emails to those people. We were forwarding them out before. I think we need to, again, we need to continue that, and that's a process as well. So.
Okay, we haven't offered assistance necessarily.
Yep. Yeah, no, we haven't, offered direct assistance. And so that's something that we could arrange and put together. I mean, maybe with a little help with a Y and or somebody else like that's dealing with people. And right now you're working, Chris, you're working on that, the hospital thing. But again, the back end to the CBD grants and the PPP grants, it's all computer paperwork that needs to be done. And a lot of people are afraid of it.
I know, like for me, being a small business, it was, I don't think that I could apply for I think you have to be in business for a minimum of 2 years. And I'm just coming up on 2 years in April for my business. So, for a lot of people that are newer in business, the pandemic could they like kill their business. But unfortunately, because most of mine is digital, I didn't have that problem because everybody was going online, so I could just shuffle that.
You're also going through a loan officer at a local bank when you do the PPP loan.
Right.
Right.
I think
So
for
if
the grant that Pete is referring to, I think one of the things we could do, all of us and, you know, as SBP is just encourage people to reach out to economic development. I mean, that's what they're there for, you
Right.
know, and Peg, in my experience working with her, has been very helpful. And if she doesn't know the answer, she'll find the answer. So I think at a minimum, that's something we can all do as we talk to businesses, especially, you know, if they're in town or if they're in neighboring towns, there's an economic development department in those towns as well. So.
Yeah, I agree, Karen. I think I have a lot of, you know, local clients that probably don't know about it. So, you know, if they're struggling, you know, to pay some things, I can at least just direct them. I wasn't aware of that. So it's good information. I think just word of mouth. I mean, Randy, I think your idea too about sending it, but I think just all of us word of mouth telling people that it's available.
Right.
The grant, especially the grant, I think is, if people aren't taking use of it, that sounds great.
Denise?
So if I could say something about the grant, because if you just go onto the town website and you just go to the town website, where the red line is on the town website, you click on, it says COVID update. When you do that, it comes up with PDFs in English or Spanish. If you click on the English for this COVID update, you're going to get a page. It's the COVID, I don't know that you can probably see it on there. Probably not.
No.
So it's the COVID-19 Southbridge Emergency Operations Center, and it's a full update page, but there are links on this page. It's not just a PDF. On the left-hand side, it has all kinds of information. One of it is, if you keep going down, local news websites, let's see, hang on here. Under the points of contact, there is latest vaccine, Harrington Hospital, town hall information, community center. There's a word, it says economic. If you click, now if you scroll down the whole thing, you're going to find this, but if you just click on the word economic, in the main text, up comes economic. And under that is exactly what you're talking about, Pete, and other things. There's grants to help businesses remain solvent. And there are two different ones listed there, the $10,000 you were talking about. Then it goes on to the unemployment or resources, there's other resources. So my point being, I think if a push from SBP through all your businesses, you've got 80 people signed up, you send emails to these people, you could email even just the town link or this specific link, which was updated just February 22nd, 21, this particular, you can share this. I'll share it with somebody and then you guys can figure it out. But the point being is it has that information. And if you click on it, it has the grant application and the contact information and to go to the economic office or whatever. Obviously, if you guys could also put something that says, if you have problems with this, one of our other business partners might be able to help you fill out the information or direct you in some way. That could be the support you give rather than specifically saying it goes off to Chris at the Y for direct help. Maybe you empower the businesses to take it on themselves, but with the notation that there's some care involved. If you want to contact one of our business people, send us an email, somebody can reach out to you. But you should, like you said, direct them to the economic office because that's where Peg and the others are used to dealing with these. And if they're still looking for more applicants, clearly they haven't gotten enough applicants. So that's one way, just through your 80 people resources, to direct them. I didn't even know this existed till I'm like, well, wait a minute, where's that grant on the town site? And I just kind of flipped through it myself, but not everybody does that.
If you also just search on the word grant, it comes up right away.
That'll come, right. So there could be something really simple, but you could put that link right in an email, embed it, send it, put it on your website, put it on your Facebook. Here it is. But you could also do it as an email blast. You could have I'm sure the chamber, I swear they've done it at some point, but encourage the chamber, encourage Alex to do it again too, or put your SBP message with that link out there and have the chamber spread it too, to all their members. You know what I mean? Get some SBP, public, whatever connection to it, that you're promoting it, that you're trying to also spread the word. I don't think it's a bad thing, obviously, but anyway, just some 2 cents when I was just kind of flipping through it, that it's available and there's where it's at. So I do agree, though, the economic office is the best way to make sure that people are doing it right and they can get a good result out of their efforts. So, but yeah, I was thinking of Jane Marie Paul. I don't know if they've applied for this one. I was thinking of making sure they knew about this one too.
When I go in to update the executive board, do you want me to add the banner back into the website at the top? That would drop this link on there. So if anybody goes to our website, it'll be right at the top of the page.
Actually, yeah, if you could put it in a banner on the top, that'd be great.
And we can send out email blasts too. That's a
Yeah.
good point, Denise. Like I was thinking direct them to economic development, but maybe kind of repurposing some of their COVID update and branded SBP. You know, that's
Doesn't
a good
hurt.
idea.
It gets your message out, keeps you current with all your people. Plus, moving on, you're going to have in-person meetings again, and you want to keep that base energized.
Well, the grant is just for 5 or fewer. Isn't that what Pete said? So it's, would we send it to everyone, or we kind of just look at which ones are members of small businesses?
Well, I think
we
we
should
can send it to
everyone.
everyone.
Mhm.
And,
Yeah.
it's like people are saying, word of mouth, helping people out.
We all know people that are small businesses. I mean,
And there are other grants listed, just so there's other stuff in this, not just that one grant. So there's other resources
Oh,
that
okay.
somebody might need. So just economically, it's a good thing to push.
So am I dropping on the banner the link directly to this EDC, or am I dropping in the link to the CDC grant itself?
I put the link to the Southbridge the town website there.
Economic, okay,
The economic development website page that's got all
Okay.
the stuff on it. I think that's what you need to put on there.
okay.
Denise says there's more than just that on there. Then again, there's different opportunities for people. And I don't know, maybe we need to go in and kind of do a little breakdown ourselves so that we know what it's all about.
Can I put COVID relief as like the caption, like just so people know what it is?
I'm going to try to send this file, Tia, to you.
Okay.
Are you still at
Well-
Tia Paradise 1?
It's almost Paradise. I can't give my husband that much credit. It's Parody, tiaparody1@msn.com.
Oh, sorry, I didn't put the E. You're right. I'm sorry, Parody. I'm sorry. So that's what I have. I'm going to send this and see if it works, because there was a link that I could send this whole thing. So maybe you can then, I don't know.
Yeah,
I don't
I'll
know
just
how
drop
that
that in there.
I think if we just even link just to like the ci.southbridge.mass.us, it's on their banner. And I
Well, the
imagine that they
COVID is, yeah.
update that COVID. I would just steal their heading. COVID-19 Southbridge Emergency Operations Center update.
I only have so much room on that banner, but I will take a look and just narrow that down a little bit.
Right. But it looks like they change it, I don't know, weekly or bi-weekly or something. And that's why they have a date on it. So instead of
Okay.
linking to a specific date, just,
I'll link to the town homepage, right?
yeah,
is
because
what
it
you're
looks
saying?
like it's on their
Okay.
banner on their page.
Mhm.
Got it.
I just making sure that people realize that when you go there, because when you go there and see their banner, it just says it's the emergency operations update. It doesn't, and then if you hit read more, actually I didn't do that. Yeah, it just shows you go to a PDF, but it doesn't tell you why you're doing that. You know what I mean? Some people are thinking, oh, this is just about COVID. How is this going to help me business wise? You almost need to either realize there's that economic information part. Do you know what I mean? So I think the banner is a great thing to make sure people can go and get all the COVID info, but you guys want to make sure that the like grant or the direct information is very easily accessible to your people. You know, because if you go in and people go, why did they send me this? I don't care about this. Well, guess what? Inside of that is what you need. They don't know that from just looking at it. So that's what I'm saying. Maybe
If you forwarded me that, I'll take a look at both. And
yeah, I forwarded you what the link was. Now, whether you want that or just even the actual the specific, say, go to this link and then you'll, here it is. I'm not sure. I'm just saying it's in there, but you have to want to look at it to figure out it's in there. That's a problem. It's
Right.
not as easy, it's everything COVID.
I'll end up paying my excise taxes or something instead of applying for the grant.
I hear you. Okay. All right. That was my COVID talk.
Nice.
So if I may, the reason too, I was hoping that you guys would, as Bob was saying, I spoke with the cable access television group today, Jim and Max. I am on the advisory committee now. We were talking about more material for cable access channel. With COVID, they don't have as much content because not as many people are, up and out and doing things. They have been posting on the cable access channels, 192, 190, 191, 92, and 94, I believe it is. I guess I gotta memorize that soon. All the subcommittee meetings, which have been Zoom, and those meetings, like my charter review one that usually is taped and they put it out there. When I mentioned you guys were doing a Zoom meeting, there was a great opportunity to get the SBP stuff out to anybody who might want to know what you guys are doing. So that's why we asked if you record it, it can then just be sent to them. They may just take Ed's portion, they may take parts of this portion or all of it. It's promotional and they want to help the businesses. They want to help the community any way they can. So
I think a lot of people have a misconception about Southbridge Business Partnership too, that I talk to, that they feel like you have to own a business to be involved, when that's not the case at all, right? You can just be a resident and be a member of the partnership. So I know when I first came on, I was just a resident, and then when I opened my business, obviously I became, but so that's great to have that. And if we are going to record the meetings, we should probably reiterate to people that are watching that you don't have to own a business. You can just be a really enthusiastic, involved resident.
Again, the big thing is what our goal is, and our goal is the economic development of the town of Southbridge. So be it, a private resident or a business, specifically the groups, is for the the economic development of the town. So
Yep.
That's where we all kind of, need to be looking at and how we do it. And there's different ways. I mean, Quasi is working with the children and stuff like that. And it's still a development there. We're developing something there. So,
That would be a good thing to get the word out about, because obviously the name is Southbridge Business Partnership. So I could see why people would conclude it's for businesses only.
Help us get some volunteers for some of our events too, I'm sure. Get some community involved.
well, again, I think we were starting our name out there with the Autumn Fest and all, but again, all of a sudden we're going on a year and a half ago now. So, time goes by and then people's memories are not as long on things you want them to remember. They remember things you don't want them to remember forever. So it's just the way life is.
So what are you working on now, looking forward in the future here with COVID still in existence? What's your expectations or hopes to be able to be more involved with the community, or to get your message out more to the community?
Well, again, I mean, at this point on the event calendars, we're looking to do monthly carpool cinemas and down at the American Optical in the back parking lot there, May, June, July, August, September. So pretty much over the summer, we're trying to, get grants for it, see what, we'll see what happens. That way we could actually possibly reduce the amount of cost to the townspeople attending. But that's one of the big things that we're working on. We still don't know where Autumn Fest sits in September. Autumn Fest is still on the books at this point, and we need to kind of do some of the groundwork on it. But again, like last year, somewhere around June, beginning of June, the end of June, is when we have to make a decision as to whether we're going to go forward with it or not. And last year we, ended up pulling the plug in June because we thought we were going to be able to do it. But again, because of the COVID situation and the way things were going, we had to pull a plug on it. By June this year, we'll find out again where we are with the pandemic, as far as where the people are and where the vaccinations are and a lot of things, regulations as to gatherings and things like that. So it's still hanging on a lot of things there. Beyond that, the SBP is working on a shop local project. And that shop local project is going to be, we have wind signs that we've advertised on, and we're going to be putting those wind signs around town in front of different businesses that are part of the SBP, trying to get people to shop local. That's main projects we have in front of us right now.
So if a person wants to join, they go to your Facebook website, your Facebook page or your website or something, get the information on how to get involved?
Yeah, either one of those, are access to joining. It lists all of the members at this point, and then the cost to join is still fairly inexpensive, at $100 for the year. And there's a bunch of benefits that you get out of that $100. We've spent a lot of time working on advertising for that. Our Facebook pages and our postings and all, trying to drive people to our businesses. So that's the background of the SBP. So.
And you're holding these monthly meetings still? You're doing Zoom monthly meetings?
Yep. No, the meetings are scheduled the third Wednesday of the month. It's fourth Wednesday of the month. The fourth Wednesday of every month is the SBP board meeting, our partner meeting. The board meeting is on the second Wednesday of the month. So we have 2 meetings every month, and bringing in all membership from around town.
Okay. Good information for the public. All
right. Hello, Ed.
Hey, Bob. How are you?
Very good. I'm assuming you've done your last meeting, so we got you on board at this point.
I am done with all my meetings for today, and you have me as long as you wish. How's that?
Well, at this point, we've been trying to fill the gap in so that we can get you on board. And we didn't have as big a population here tonight as we'd like to have, but
sure.
And I think some of us are anxious to hear, what Harrington's been doing and just to update the community as to where things are, all
sure.
COVID related.
Sure. Let me do that. I think many of you know our surge that we just had on the inpatient side has really come down. We have a half a dozen patients or so in the hospital. That's good news. We peaked about mid-January at 24. So we went through a big surge this time around. Compared to the first time, it was only maxed out at 12 on the inpatient side. I think we, as you all also know, we got into testing really early and still have 2 testing sites, one on South Street and one in Webster primarily. And those are still warranted to keep open, especially because of travel and other reasons. So we continue to do testing. I think we've done over 48,000 tests since the beginning. So that's pretty robust numbers there. I think the big issue for everyone right now is vaccinations. And, I'll answer any questions. I'll tell you what we're doing. The bottom line is I think, as you may know, or if not, I'll fill in the blanks. We got originally Pfizer vaccine and got more than enough to fulfill the needs for our employees initially without having to prioritize, as well as first responders, police, fire, EMS in all the towns we serve. So we did that in the first month, basically from December 16th, and with the second dose it went on, but through probably early February, we were well done with that. That's when because we were doing it offsite at the community center, that's when we made a conscious decision and applied and negotiated with the state to become a regional and a statewide site. So with that, it allowed us to continue to get supply. For a while there, we actually received more supply either than we can use, or even supply that we didn't even ask for. It was a little bizarre for a few weeks there, where one day we got 4,000 doses and we hadn't even asked for it. We actually told them, and they took us up on it, to give it back to reallocate to others, because you don't want to be in a position where you're not getting the supply in the arms as soon as possible. So what we've done is we went from 150 a day. We made the conscious decision, knowing that we were statewide and the website for the state and then other efforts, to get up to 500 a day. And we are already there. We staffed for it Monday through Friday, 7 a.m. to 7 p.m. We are, a normal day now is at least pretty much 500 scheduled. Some may not show up because they found a closer place to go to. Although I will say probably 80 or more % now is locally based who's getting it. At the beginning, we had people coming from the Cape, from the Berkshires, from anywhere, because they qualified under the criteria, and we had available slots earlier on. As we get more staff, we open up more slots, more appointments. We also ended up looking at, and how can we, and we are probably on March 20th or so, going to open up on the weekends. And we'll start a Saturday clinic, probably to start with 6 or 8 hours and then move to the following weekend, up to 8 hours both days. So I think that'll add another 300 to 400 easily each day of those weekends. So in no time, we should be in the 3,500 a week range, which is, I think, pretty remarkable for a small site relative and compared to, say, Gillette or Fenway. But as others open, we want to make sure we stay focused on the local communities. We've been able to do it with the use of the community center. We've been able to do it because the town and the police have been very helpful around parking and traffic control. We work together on a weekly basis with all the boards of health, including Andy and Southbridge and others, to really make sure that every one of those towns can help people. A lot of them through their senior center. I know in Southbridge through the Y, they are helping people sign up and get on the site and get the appointments. Sometimes it gets frustrating because appointments get filled up quick, and then, it depends how many more we can open when. We're trying to prioritize those in the local area. So bottom line is, we had a little scare about 2 weeks ago, because we had, well, let's put it this way. I was on a call. The real story is I was on a call with the Mass Hospital Association CEOs from throughout the state. And many of those hospitals had not, 90% of them, unlike us, did not offer themselves up as a statewide vaccination center. They were still doing their own employees or just their own patients. And the governor made a conscious decision, along with, shortly after, the local boards of health, to not supply those entities. This is about a week ago now. And he wanted to supply the larger centers because it's more efficient and you can get more doses out quicker if you supply them. And especially with the Pfizer, where you need to have ultra cold storage, and you open a vial, you want to make sure you use it, you don't waste it. So we were concerned, would we be thrown into the category with the other hospitals and get shut off, and all the appointments we had scheduled would have to be canceled, or were we treated differently? And with a lot of help from especially legislators and others, we got, there was a meeting held with Lieutenant Governor Polito, who, based on the whole discussion, committed further, again, recommitted, I should say, that we would be treated just like Gillette. We would be provided supply to keep us going, which is critical, because we could get all the staff we want, but if we can't get supply, what good is it? And if those allocations got tight, because there was uncertainty how much they were getting from the feds, while local CVSs are getting it through a different program, we didn't want to be shut out, because we already geared up. Why would I want to take it down? So we're continued. In fact, yesterday we got another 3,500 doses, which lasts us a good week, over a week. We'll probably get another shipment of 2,500 or so next week to keep us level. And as we get into the real weekends later in March, we'll just ask for more, and I'm sure we'll get it. You might have seen today, Johnson & Johnson got, I believe it was final FDA approval, or will. We're not sure how that's going to play out in terms of, I think it'll start rolling out next week, but we're not sure how they're going to determine who gets which vaccine. I suspect we'll keep getting Moderna, which is mostly what we've had. I'm sorry, mostly Pfizer, and we have a little of Moderna. We had about 800 Moderna and another 10,000 of Pfizer. So since we have the capability to take the Pfizer, we'll probably keep getting that. That's a quick summary, but I'm wondering, people have individual questions, anything I can answer? I think it's been a great partnership with all the towns, because every town would have had to fend for themselves if they wanted to do it. And it's different than a flu shot. It's just not it's not someone sticking the arm and you walk away. There's a much larger information registration process that involves going to the state with that data. There's a much more careful approach afterwards, that you have to wait 15 minutes or more, depending on if you have a reaction. And we've had a few people with reactions. 1 or 2 have gone to the ER, but they've been fine. But we have clinical people there to watch them in case there is any reaction. You don't want to have an event that's avoidable. Yes, Randall.
Hi, Ed.
Hi.
I'm a little confused about what the state has said about reallocating doses to the pharmacy chains.
Mhm.
And it seems to me that they are far less equipped to deal with this than with mass administration than places like Harrington. What do you think?
I agree 100%. The thing of it is this: the pharmacies really played 2 roles, and think of CVS and Walgreens, large pharmacies. And what the first role they played was in January with nursing homes. They went in with people to vaccinate in the nursing home, which is great. That part I agreed with. I thought it was good. I was more committed to doing our employees and first responders during that first month. And I'm glad somebody else picked up the need to vaccinate the elderly in nursing homes. The part now that's playing, and that was through, and we got to be careful, because I don't believe it's the state that is responsible for the allocation so much towards the pharmacy chains as it is the federal pharmacy program, they call it FPP. So they go, the pharmacies are getting it direct from the feds, which is different and over and above the allocation the state gets directly and then gives to us. So the question really is, the feds are eating up some of that, if you will, supply to put in the hands of the pharmacies, who by definition, because we're not in a state where you could set up a drive-through with thousands of cars coming through a day, or hundreds of cars. They're setting it up, as I've seen one, actually I saw it in another state, where they carve off about 50 square feet in their store, and they have chairs where 6 people can sit after they get a shot. They'll be lucky if they could do 20 or 30 a day. That's not very efficient.
Right.
So I think that's my understanding, is that's a federal program that supported the pharmacies. Now, by the same token, our physician group, we also applied for doses. It's a separate corp, so we had to apply separately. We applied for supply for the physician group to eventually get to a point where we could do it in our larger offices, where we have enough waiting space, where we could administer the vaccine. We'd probably do it, not necessarily during a normal visit, we'd probably do it on a Saturday, say in our Sturbridge office, or a larger office in Charlton, where we could bring in some staff and get through some volume through that way. I think the key is, where can you get high throughput and get as many doses in people's arms as
Exactly.
quick as possible. It's a very simple goal, but once again, if it's not as simple as a flu shot, you got to have the right pieces of the puzzle put together. And we've demonstrated, I think, in the Southbridge site, that we figured out, because we played around with the throughput while we were doing our employees. So we then could use it to do it for the community. And that was the whole goal. In fact, just as an aside, two things. About a month after we did it, I talked to my colleague up at Haywood, and the town was doing it very minimally, but doing it. And he had done it for his own employees, but he hadn't yet become a statewide site like we did. About 3 weeks ago, he became a statewide site, and now he's designated just like we are. So he liked the model. He sent people down, he looked at it. The other thing was today, I believe I was told there was a press release going out from the Lieutenant Governor's office, and there was a press conference. I haven't seen the result of it, by the Lieutenant Governor around vaccinations and other things. And she was going to reference and comment on what we've done here, which I think is good recognition that we should get, because I think what we've done is, way ahead of a lot of communities and a lot of hospitals. So that's the story on that.
So as far
Other
as
questions?
pushing the vaccine out to local physicians' offices, I think it's the Pfizer that has to be held in ultra cold storage.
Yes,
You have to administer that once it's removed from ultra cold storage.
I think you have 6 hours when you puncture the vial, and you have so much time. You could use dry ice for the interim period. You just can't store it for weeks at a time, obviously. Moderna is more appropriate for physician offices. It doesn't require that level of freezer.
Right.
Isn't the Johnson & Johnson going to be even less? That's a
The Johnson &
single
Johnson,
shot.
number one.
Yeah.
Yeah, it's supposed to be one dose, number one. They're talking about boosters or not. That's always the question, or the uncertainty of how long the vaccine is going to be effective for. So that's a real another question, because what if it only lasts 6 months? What if it lasts a year? We're still back at it. Is it going to be one shot or 2 shots in the future once they learn? And of course, what about the UK or these South African variant? And are these vaccines truly effective against those? And what if they continue to, become more mutated? So I think we're into all of those things, and then what's the effectiveness of Johnson & Johnson compared to the others? It didn't have as high a number, but it still prevented the mortalities from happening. So, and I'm not so sure that people will have a choice, meaning whatever vaccine we get is what I'm going to give out. And we, even Moderna or Pfizer, we didn't ask preferentially, which do you want? We just gave out as we got it. One difference, of course, is Moderna, you have to wait 4 weeks supposedly for your next one. Pfizer was 3 weeks, not a big difference. And then the other part is it's hard to manage, and I say the folks at the vaccine center are working hard. It's hard to manage people who get on the schedule who may not meet the criteria. You can, I'm sure, creatively get through the system and maybe not fully meet the criteria. And given the governor did open up a week ago, 65 and over, and 2 comorbid conditions, it's really hard to police that. And we have people I know sometimes waiting online out the doors, and the feedback in general though has been very good. And I think I'm pleased that we can offer it, because without it, I think it would be a real nightmare trying to push. If you think about it, we like to think we serve 16 or 18 communities, probably total population 175,000. If 3/4 of that is eligible based on age, ultimately, it's well over 100,000 people at 2 shots apiece, or 1 shot if it's Johnson. So either way, if you're pushing out 10,000 a month, that's still a long time to get it out there. Hopefully we can continue to escalate that, or people will go elsewhere to find it. But that's an undertaking. That's a long-term undertaking. It's not just for a couple of months. You know, it's really like we're in the business of doing vaccines for a while. Now, the good news is when we made the decision to do it, we bill insurance companies, but we know that Far Out is underpaying us for the cost that we were incurring. The good news is we found out a month ago, after we were committed anyway, that federal government through FEMA will reimburse us for losses associated with vaccination. And FEMA will also provide some relief for the towns. And obviously, if the 1.9 trillion passes, there's some money in there for towns as well. So we'll have to see how all that shakes out.
Well, I've been up to the vaccination center in Southbridge a few times, and I'd like to give you the feedback that everybody is so impressed with how well it's working.
Well, thank you. And what I always like to say is, in our business, we deal with people who are going through difficult times a lot, and you know, it's very rewarding in the vaccine centers to see that on both sides of it, the people who are administering the vaccines are very proud and happy to be there. You almost could see the smile through both masks, you know, meaning the caregiver is given it and know they're making a difference to people who want to come in and really want it. And you could see the relief on people's faces who get it. They're just so happy to have reached that moment where they say, at least I feel there's a beginning to this sense of protection and ultimately someday normalcy, right? And I think us being a part of that experience, I feel fortunate that makes me really proud and happy that we could be in the middle of it all. And I get emails and letters and feedback that I share with the board and everything that is remarkable, because it's, you know, and it's something that I like to believe we had a choice. We didn't have to do it, but we chose to do it. We had to do our own employees to protect our employees so we could care for patients. But we didn't have to put ourselves out there to take on hiring another 20 or more people, managing it, gearing up. I mean, honestly, it's probably just, if you think of it this way, it's one more headache, right? in running a healthcare system. On the other hand, it's our mission. It's our job. It's our job and our desire and our, you know, for me, it's the pride of saying, wait a minute, our mission is to make this community as safe and healthy as possible. And I always say that this way, if not us, who's going to step up and do it on a broader scale? And there's no Gillette in Central Mass, if you haven't noticed. There's no, even Worcester State, they might get up to 2,000 a day. We'll be up to 750 probably within a month, let's say. And the anxiety out there is all about how quickly can I get the shot? So it's up to us to really drive that. And that's what we've been doing. And I'm pleased because, like I said earlier on, most hospitals didn't jump into it that way because, for good reason, they had lots of other things going on, but so did we. And we just said, you know, we're gonna jump on it because I recognized how important it was to the people who live and work here. And I'm hopeful that we'll get through this. Hopefully, maybe there'll be some sense of getting back to basics, normalcy, as we say, in the summer, if a large percent are vaccinated. One thing that could be helpful, and I worry about this, even with our employees, initially only 65 or 70% said they want the vaccine. And a few more are coming forward now because they saw people didn't die, they didn't get that sick after the second shot. Some were just waiting and seeing. But if we don't get to the 80 or 90% of people willing to take the vaccine as the supply and eligibility becomes available, then we're still going to have the virus lingering more and more and be transmitted. So how do we all together educate people to get them on board with being willing to get the shot? Because if they don't, it's not helping the greater good. And for me, it's about getting this virus, at least for this year, not to have another surge, to get it by us, and then see what the results are for the following year, and hope that it has some lasting power, that it'll not be, effective after 3 or 6 months, God forbid. That would be a nightmare. So I think we need to, encourage everyone as best as possible when they're eligible to get it. Other questions you guys might have, because I really am happy. Yes, Peter.
Yeah, hi Ed.
Hi, Pete.
Big Bunny, as you probably know. I was just wondering, when we get to the point where our employees are eligible for the shot, is there a way that we can group them in some way, that we can register them internally or help them register, and get them lined up? Because, frankly, if we leave it to them individually, some will do it, some won't. Some will give up easily, even if they try. So I'm thinking, if there's some way that, we as a company can group them and present them for the vaccination.
Yeah, I mean, you could assist them in registering, but we've not chosen yet to say we'll do groups of people either in block or off-site yet. We are thinking about like reaching out within the community, and maybe this will help in a mobile way. Can we take the van that we have, put it in front of your store? Could we put it in a more strategic site in the middle of the Latino community perhaps, and get people vaccinated that way? It still would require registration still, and it's a little more difficult logistically, as you could imagine. But, if they're having trouble, or if they're eligible, or when they're eligible and they have trouble signing in, then I think the Y made an effort, the senior center is making an effort to help people get online and get an appointment. Yes, Chris?
Hi, Ed, I'm Chris, and I'm the new executive director of the Y. I've been there a couple of years.
There
So
you
I
go.
was just gonna speak right out and say, Pete, send them over to us.
Right.
Give it a call. We are so quick and efficient now, and I can do this in my sleep and register people. I'm
And
not,
that's a huge service, because at the beginning, especially with the over 75, they either didn't have the right computer, or they couldn't understand, or they couldn't get online, understandably. So they need that support system to walk them through it or do it for them. And, the Y or others in other towns are making that effort. And I think that's the link, that's the bridge that we needed. So thank you for doing that.
Thank you.
Do they
Denise?
have to go in person with you, Chris, or is it a phone call to
Nope.
register?
you can do either or with us.
Well, the reason I say that is, Pete, you could offer up during their break time or something. Here's the phone line. She knows Pete, you could set it up where there's a time when Big Bunny people, certain shifts, are going to contact you, and that would give you that feeling, Pete, of the company-wide push to get your people,
Right.
Inoculated. Maybe something like that. Do a little plan where she facilitates it, even if it is by phone, but it's on,
All we
something.
have to do is serve pizza, and they'll come.
Right. And make a phone call to get your slice of pizza.
That works, that works.
I was going to say, Pete, some of my employer groups, on the employee benefit side, they've asked me a lot of questions, and they've been actually incentivizing. I have one company that says, if you go and get it, you'll get an extra vacation day, or, you'll get a half a day of work. So, or like you said, the pizza, but that's what I'm seeing on my end, is the employers are giving them incentives to go and get it, and, hang the fish in front of them or whatever, just to get them to go.
That's great. That's great. No, I think it's a matter of now rallying the rest of the community as they're eligible, because we're going to be inundated for months. And I, just be patient, tell people to sign up when they should. They'll get an appointment, but be patient, because I think it's just, and like I say, we're now able to hire people, not only rely on volunteers. And as we do, we'll get more steady people working there regularly, and I think can grow beyond even 500-600 per day. So, and I think the town's been great. We have a weekly call, by the way, with a dozen people everywhere, between Chief Normandin, Chief Woodson, Mike McCall, you name it, they're all, Andy, they're all on the call, La Rochelle, Roland. I mean, a lot of people involved in making sure the operational aspects continue to work well, from opening and closing, cleaning, etc. And then, I've got security there. I've got, a whole bunch of nursing folks there. We're using, by the way, Quinsigamond Community College students, which have been really good, Medical Reserve Corps. I mean, we've pulled out all stops to try to get, and especially initially, volunteer and otherwise, and the other towns as well. I know Sturbridge, Charlton, a bunch of them, the boards of health in those areas, they've been every week in really good communication with us and doing the same thing to try to get people to come. They wanted to, some of those towns were on the verge of setting up their own, what I'll call pop-up clinics for the day, until the state shut them off with vaccine, and they were super disappointed. But at least we continued, and if we were shut down, then it would be a disaster for the whole region. So I'm so pleased that our legislators, and if you see them, thank them, Peter and Senator Fatman and Goby and McKenna, they all rallied round for us. And I would say we stirred the pot pretty well and got a good response. And I don't mind doing that ever, that, because I think we have to stand up for getting what we need, and having established a model that should be emulated, not shut down. I was a little ticked off when they potentially would have cut us back to zero. So we prevailed, and I think we're continuing on. So all good stuff.
I got my
Yes.
shot just last night, as a matter of fact. And my appointment was at 5:45, and I was home at 6:25.
Wow. That's perfect.
Yeah.
Yeah. Was it
Very
busy
well
at all? It slows down then usually. Was it busy?
Well, there wasn't a line out the door, but it was steady. There were people at every booth getting processed, and there were people sitting waiting to be taken, and
Good.
but it went very well.
Well, that's what we.
Machine.
What's that?
It's a smooth running machine.
Well, that's what we hope to hear all the time. But, I know sometimes, like with the snow days, my God, that was a disaster. Could have been a disaster. But we actually squeezed people in and shut down like half a day or less, but still got almost the whole day in, just because they went crazy trying to do it quickly, and it worked. So, fortunately, there's no major storms in the forecast, and hopefully that'll be behind us in another few weeks or month. But we're rolling along, and stay tuned. If there's anything else, we'll keep you guys posted. And thanks for asking me to join you for tonight. I appreciate it.
I do have one question.
Sure.
If you work in Mass, but you reside in Connecticut, you're still able to go through Mass?
I believe we wouldn't I don't think we turn you away. Well, let me put it this way. I have a lot of employees that live in Connecticut, and I know we vaccinated them.
Yes.
So I would think that would be the case. I wouldn't turn anyone away that way. You still have to be identified in the system as to what town you're in for reporting purposes, but it gets a little tricky. I mean, I'm sure it's done, because like I say, I'm sure I have a lot of people in Woodstock and elsewhere that we vaccinated. It's just a matter of where the data goes.
Right.
But I'm pretty certain it's probably okay. I thought a bigger question was, I thought of this question. I know people who used to live here, or maybe it's kind of, what if you live in Canada? Would you think we're allowed to vaccinate someone coming down from Canada? Maybe they have a residence in both places, or maybe they used to work here. That's an interesting question. I'm not sure the answer to. I got to find that out. But yeah, Connecticut, definitely. We have plenty of employees, I'm sure, as you might know of, that work in Massachusetts. We should vaccinate them.
Right.
So I have no problem with that.
Okay, thank you.
Sure. Otherwise, anything else for me?
Yeah, Ed, could you tell us just a little bit how the hospital itself is handling things? I mean,
Oh, sure.
obviously the surge is gone, all that, but I mean, how is the hospital economically doing? This is business partnership. You are a business here in our community, a
Sure,
large
sure.
employer.
Well, two things. Thank you, Denise. Two things. We are holding up. I would say the challenges are a bit greater because there's still some portion of the population that has not chosen to get their routine medical treatments, which means less volume and less revenue for us. And it's very apparent in the ER that the ER volume is about 20% off, which is no different than most hospitals throughout the state, which doesn't make me feel much better because that's revenue we're not seeing. And that's both ERs. So on a typical day in Southbridge, we used to see 70 patients a day. We now might see 55 or 60. And ER, with the generation of other tests, generates a lot of revenue. We closed urgent care in Charlton, so that's a loss because it wasn't volume enough at the time to justify it. Oxford urgent care is open, but in general, certain volumes have been soft. We've had through the first 4 months of this year, we're off target by a couple of million, but we're not in rough shape because the federal government did give us money for last year's losses to some degree. So we're okay there. Now, the next question ought to be, and I'll just say it because I think it is a good question. So where's all that lead to relative to where we are with the UMass Memorial acquisition?
Are you all aware of that?
And
I'm just curious because maybe people don't even know.
finding
Just saying.
Oh,
or being acquired.
Lost him.
If you then you live under, you hear the news somewhere along the way. So yes, thank you.
Uh-oh.
uh-oh.
We
Ed,
are
we lost
under
you.
regulatory review right now. You lost me?
There you
Yeah,
go.
Can you hear me now?
Yeah,
Am I back in?
rewind 30 seconds?
Back to-
Okay. Can you hear me?
Now we can.
Is it okay? Okay.
Yeah.
So the am I good? Good?
Yeah, rewind 30 seconds.
Okay. All right. So bottom line is UMass will acquire us likely by around July 1st. And then we're part of their system. They understand our financial situation. We still are moving ahead with major projects. We're finishing up the ER here. We just received a CAT scanner to go in the ER itself as a second CAT scanner in Southbridge. We're taking our psych unit from Southbridge, expanding it and moving it to Webster. So we'll have 40 psych beds between 2 units over in Webster, probably by October. And things are moving along very nicely with that. So that's the update there. Any other questions?
Ed, I have 2 questions. Elvis here. How you doing?
Elvis, I'm well.
Excellent. Do you see the COVID shot eventually 3, 5, 10 years out being like flu shot and doctor's office distributed? And I like to get my crews CPR certified, but I haven't been able to access John on a different note.
John,
I don't remember his last name, but he would
John
work at
Gorman.
the hospital and did all my CPR certifications.
Yeah, he's no longer there is why you can't access him.
Do you guys still have access to certification?
CPR?
Yep.
Yeah, probably through Jason, I believe, Jason Osborne. And
Okay.
he runs the vaccination center as well. So I can reach out to him and have him contact you about how many people you talk.
Usually I come in with 6 or 8 as a group. We lost you again.
Yep. You lost us.
Sure. And as far as the future of the vaccine being like a flu shot, I mean, I have no idea. That was way beyond scientific understanding. I think it's really, there's not been enough experience to understand um, you know, from where it's going to land. And I think I can right now and stay tuned and hopefully be in a better spot so we can beat it later.
All right, you broke up on part of that, Ed, but in the end, it was still okay. I think, like we all.
I'm sorry about freezing on you guys.
That's all right. That's the internet.
Must be the internet. Yeah, on my end. But if you have any questions, email me or call me or let me know.
Yeah, I was gonna say, any other questions
Did you
from
hear that?
anybody online here?
No, but Ed made a point that the hospital is open for business, and that, we were told in our meeting, is the message he wants out there for the community. So that could be another thing that you guys push through your business, through your members.
Please.
Emails, is that the hospital is open for business in terms of can't even think, testing, mammograms, colonoscopies, all that stuff, the regular items. They are open and have time for the public to come in and get their tests. Don't put them off. So the most we can
And
promote
it's
that.
safe
people are
there
afraid.
because many of our employees are, and it's safe there because many of our employees are vaccinated. Did I freeze?
Yeah. Anyways, all right.
All right. Thank you, guys.
Thank you for coming, Ed.
You're welcome. Thank you.
Thank you.
Bye-bye.
Yep, thank you very much.
Thank
Have a
you.
great evening.
Thank you.
Bye-bye.
Thank you.
All right. So looking at my calendar, just so everybody knows, we're looking at March 24th as the next partnership meeting. And the board meeting is March 10th at this point.
Are we looking for someone to sponsor, a partner to sponsor that March 24th meeting? Or do we have a sponsor for that meeting?
At this point, we don't have a sponsor. If somebody's interested in doing that, we can actually probably should talk about how we would manage that because we're still going to be on Zoom to you. So
I guess they would just have an opportunity to share for a few minutes a little bit about their business. Would that be?
yeah, no, that'd be fine. We give somebody the floor. I mean, it'd be the same way as what we're doing when we had an in-person meeting type thing. Basically give them the floor for a portion of time to talk about their businesses.
Bob, would there be, I know we're coming up on an hour and a half here, but
Yep.
would I be able to take just a few minutes to talk Southbridge Industrial Mural Project?
Yeah, no, why don't you go ahead with that and we can try and finish this up by, maybe get it done by 7, Randy.
Yep, I'm gonna be quick. Can you let me share my screen? Whoever's running that.
Karen?
You should be able to share.
Great, got it, thank you. Okay, can everybody see this Mass Development Commonwealth Places?
Yep.
Yep.
Okay, great. So this is a program that is, as you see from the title, in response to COVID-19. They're calling it Resurgent Places. And it's about grants from $250 to $50,000, locally driven placemaking downtown and neighborhood commercial districts. And a lot of people can apply for it. We qualify. And there's 2 categories, seed grants and implementation grants. We're going straight to the implementation grant because I think we have a pretty clear idea of what we want to do. There's a few examples here of outdoor dining and pop-up retail and Haverhill. Greenfield micro grants for equipment purchases related to outdoor opening needs. Tactical urbanism. How's that? That's a pretty good phrase. This is a pretty cool MAP funding program in, that was in Lowell, I forget. And so it's really about diversity, equity, and inclusion. And since we have such a large Hispanic population in Southbridge, I think that we will qualify on those grounds, not just Hispanic, but other significant minority populations.
Oh, mhm.
So this is my building in Southbridge. It's, and as you can see from the image, there are these, what I'm calling mural-ready panels on the building. There's 4 of them. They measure 7 foot by 20 feet. When I first bought the building, my first thought was, how to put murals on those? They're great. But now I'd like to actually try and pursue that, and it looks like this grant could be appropriate for that. So the idea is that we would solicit proposals from area artists to produce art that would address the industrial history of Southbridge. And I'm going to switch to this screen here. So a little bit of, Southbridge history here. And so the project's aims are here. Educate residents and visitors about the proud history of Southbridge. Illustrate the advanced technologies that are being developed in Southbridge today. Envision the future of technologies in Southbridge. Provide local artists of color with grants to produce mural arts that illustrates these aims. Print large murals and display them on a rotating basis at the participating locations. And inspire children and young adults to seek careers in the technology economy that Southbridge exemplifies. So this would be submitted under the Southbridge Business Partnership. In particular, I am looking for suggestions, not only for program content, but for locations in Southbridge who might be willing to participate in the display of this art. It would be great if we could standardize on a 7 foot by 20 foot size. I'm thinking that Franklin Realty should be approached. I'm willing to do that. And I'm hoping that we can find a site right in central Southbridge. Perhaps, I don't know what's happening in that empty lot where the building burned down, but there's a big wall there right now. And so if anybody knows what's going on there, can enlighten me. Maybe that's a potential location. And I yield the floor to our president.
Okay, well, just so you know what's going on in that empty lot, that lot is owned by Hyde Group. So there's a proposal of a building to go up in there. And at this point, I mean, because of COVID and everything else, everything's got pushed off. And then the infrastructure going around with them working on Main Street and all of those things, that's helped kind of push all of that out. We didn't have water or sewer for water supplies and stuff like that. So until Main Street is all done, we're all waiting for all of that stuff. But again, I was talking with Gabe McCarthy the other day, and again, his mural that's on the backside of that building need of repair, and he was thinking about maybe getting it redone and maybe just starting from scratch on it, type thing, and having a completely new mural done. So again, other people around town are thinking about the spaces that we have available to put something like that up. So
That's the mural up above Fidel's.
yep.
Yeah. So who owns the mural that's on the other side of the parking lot? Is that the old, is that the Napa, the old Napa, maybe where the fire station is
Napa,
gonna
which
go?
is, yeah, that building right now is the one that they're recommending for the one of the marijuana facilities in town. And so that was the.
Will that one stay?
What's that?
Will that one stay? Will that mural stay?
I'm not positive there, Tia. Again,
I was taking pictures of them the other day. We have some really amazing murals.
yep. No, we do have some around town. So I
Yeah.
mean, there's space for a lot more too. You know, as Randy points out. I mean, and again, 7x20 is not huge. I mean, most of the buildings that you could put on, you could actually put 2 7x20s on most of them or something like that. If with the buildings with the open space. So I know the building, the old Gregoire's building there is got open. That whole side there that's on the alleyway is all open. And so there's plenty of building space around town, that's for certain. So the big thing is probably part of the project would be gathering space, you know, that's available, that's open, and finding out if owners would be interested in getting involved in it.
Right, right. And I'm hoping that we can tie in Dick Whitney's wayfaring grant with this whole effort.
Right. Now, that grant you're working on is also the same one that I'm working on for the carpool cinema. And again, the whole it's the same grant, and the whole idea was to for us to actually get like a portable one of the blow up screens, so that we could perform, you know, do these movies on a regular basis with a lot less effort. That's for certain. Own one of our own screens, and then, you know, all of a sudden the cost is substantially less. That was the biggest portion of the cost of putting that on over the summer.
Investment, yeah.
Was that screen rental. So
good stuff going on.
Yep, there is. So any other comments tonight? Motion to finish the meeting. How's that?
Seconded.